right, so what types of symptoms did you see in that video? Because really, that was like almost this whole lecture on bipolar was contained in that video. So what types of symptoms?
Someone's been in my bedroom cupboard, and I know it was, and I took it. I wasn't
Oops.
doctor.
I guess I didn't.
I've been on leave seeing
Sorry.
my mum, right? And I come back and I've gone to my ward.
Okay, I guess I didn't shut that off. Sorry, I thought I did. Scared me a little. Okay, so what types of symptoms did you see?
She was having a lot of anxiety. She couldn't focus. She was like jumping from one subject to another.
Okay.
Some of the subjects didn't even make sense. Like when the guy was talking, I forgot what he said, and she started singing. Yeah.
Okay. All right, she started singing What's Going On, right? Marvin Gaye song, right? She started kind of going off on that. Okay, so that is a very specific symptom that we see in bipolar disorder. So sometimes they do rhyming and clang associations, which is kind of choosing their words based on rhymes rather than actual, like, making sense. And she kind of, her thoughts were all over the place. Her anxiety level seemed high. Okay, what else did you notice about her? Yes, her eyes were constantly moving. Mm-hmm. What else? Mm-hmm. Okay, sometimes she avoided answering questions. Mm-hmm. Yes, very fast pressured speech. So she had some pressured speech, just really rapid communication. So her language was foul. Yeah, that's very common. I mean, truly, this is a very realistic video. She was in her own home at this point in time, or apartment. And so what did you notice about the environment that she was living in? It was a mess, right? What else did you, besides the... Yep, we saw kind of a bottle of alcohol there. So she's probably drinking to self-medicate, which is very common. And what else did the guy who's assessing her, he said something about her environment also. The lock was broken on the door. Okay, so she's living in an unsafe environment then and not maybe even really aware of it. Okay. What did he say about her general daily life habits? I think he talked about a couple of those things. What was she having trouble doing with her, like, ADLs? Yep. Eating, sleeping. Mm-hmm. Did she look well groomed? No, she looked a little disheveled too, right? So she's probably not bathing, taking care of her hygiene very well.
I noticed she had shorts on, and the other two people seemed to be dressed for a different type of.
Okay. So well, that's a good observation, because there are times when people don't dress appropriately for the weather when they have bipolar disorder. There was somebody who was taken to the hospital because they had a bathing suit on and a bathrobe over their bathing suit, and they were, I forgot if they were at a store or if they were at a restaurant or something, but they ended up coming to the hospital. They were dressed really inappropriately and it was winter. They had a bathing suit and a bathrobe, so dressed very inappropriately. So it's possible that could be. Anything else about her that you noticed?
She said Jason would never do that again. He would never, he did before, but he'll never do it again.
Okay.
He would never take drugs.
Okay, so she was kind of denying a lot of things that were going on, because clearly she had a black eye, right? Besides her eyes kind of moving around a lot, darting around, she had a black eye. So she was in some kind of an abusive situation. So who knows what her boyfriend is like, but sometimes when people are manic, they don't use very good judgment as far as their relationships. And so perhaps she's in a relationship that is abusive right now and doesn't have the insight or ability really to get out of that situation. So did she say anything that sounded delusional at all, like it wasn't based in reality? Ah, okay. They were together in a past life. Okay. All right. Other than that, I didn't really notice anything like acutely delusional, but sometimes people can have really very false ideas. They can have very grandiose ideas and think they're somebody special or important. They may think they're a king or a queen. They may think they're God. So all kinds of different. She didn't really have that, but.
Remember the one she told me that she could speak to dead people.
Yes.
That she predicted 9/11. She predicted.
Yes, that's right.
Pearl Harbor, or like something. She said
Yes.
she predicted all these things. She was manic, but not like her.
Right.
Pretty close, but.
Yeah. Okay, yeah, great example. Very, very good example. All right, so bipolar disorder. So bipolar 1, I would guess the person in the video probably had bipolar 1. That's the most serious aspect of bipolar. Again, everything's on a continuum and everybody is different. But it is the most severe, highest mortality rate of the 3. They have to have at least one full-blown manic episode. Okay? And bipolar 2, at least one hypomanic episode. So anytime you see hypo before a word, it usually means less than. So they're not as manic with bipolar 2, and they're not quite as depressed. But they have to have at least, for bipolar 1, at least one full-blown manic episode, and then a depressive episode. It doesn't say on the slide, and then for bipolar 2, hypomanic, and then a depressive episode. Okay, so that's kind of. And they used to call this, what they used to call this? I can't remember now. Okay, anyways. Well, they used to just call it manic depressive disorder, but now they call it bipolar. So cyclothymic disorder is alternating symptoms of mild to moderate depression and a little bit of mania symptoms, but not very, very mild, at least going on for a 2-year period. Most people with cyclothymic disorder don't end up coming to the hospital because their mood fluctuations are minor and they may cause them some distress, but it's not serious enough to warrant being in the hospital. However, somewhere in the book, I think it might still say that bipolar 2 doesn't warrant hospitalization, but actually if you don't catch somebody when they're in a hypomanic episode, there are times when they can get worse and they can actually need hospitalization. So we do see people with bipolar 2 in the hospital. You can have rapid cycling with any of these disorders too, which means that their cycles of moods can change very quickly. It can change day to day, week to week, month to month, rather than maybe a couple times a year. So, all right. Okay. Case study, Miss A, 53, has just been admitted with bipolar 1 and is in the manic state. Which symptoms might you see? Well, we just saw a whole bunch of symptoms. We're not seeing catatonic, right? Catatonic we haven't even really talked about yet, right? We're going to talk about that more in schizophrenia when people are just absolutely not responsive. They may close their eyes, they're not even talking to you. That's not what we're going to see. Racing thoughts would be something that we've seen, right? That's what we saw in the video. Low self-esteem, tearfulness is more depression, and lack of interest would be more depression. So, again, that video was a really good example of somebody that had full-blown mania. So, about 21% of patients with major depression may actually have undiagnosed bipolar disorder. It is hard for physicians to diagnose because sometimes they actually can look like they have schizophrenia. So if they're really delusional, they can look like they have schizophrenia. They may be misdiagnosed. Bipolar 1 is more common in males, bipolar 2 more common in females, and cyclothymia usually begins in adolescence or early adulthood. So bipolar 1, we really do have to, think that they have very serious symptoms. Okay, so Miss A is an adjunct college professor who has published 2 novels and working on a 3rd novel. She said, it was almost inevitable because I grew up in a family of 5 anxious girls with competitive, ego-driven professional parents. It was hellish. I found escape in writing stories and putting on plays with my sisters. When I got a scholarship later, I practically ran away to college where I absolutely lived on coffee, books, and the drama department. So she further describes her childhood, We all had to compete if we wanted attention. Dad played favorites depending on our grades and talents. I was his favorite, but I hated it because it made my mother hate me. So sometimes you do see some difficult family dynamics. How could she compete with her own daughters? Sometimes in high school I scared myself with how much I just wanted to hurt them both. I decided I would never marry and have kids. So I'm guessing she has a genetic predisposition, also perhaps based on a little bit of what we know about her parents. So based on her history, it looks like she probably has biologic, psychological factors, environmental factors, all of the above, for sure. So we're looking at their mood, their behavior, their thought processes, speech patterns, and their cognitive functioning. So we did see pressured speech in the video. Circumstantial, I'm not sure if she was really circumstantial, but what that is if you ask somebody what time it is, they tell you how the clock was built. So they give you all kinds of extraneous details that aren't necessary. So it takes them a long time to finally get to the point and answer your question. So it can be frustrating when somebody is bipolar and they're having this circumstantial speech, because maybe you just are in a hurry and you just want a quick answer to your question, and you don't necessarily have the patience to stand there and listen, and they may take a while to get to their point. Tangential speech, so they go off on a tangent and they never get back to what they were originally talking about. So like in the video, she seemed kind of scattered in her communication. They might have some loose associations. So even like with what's going on, when he said what's going on, and then it made her think of the loose association of going off into a song. So something might prompt them to think about and talk about something else. That flight of ideas, rapid thoughts kind of coming out, and the clang associations, they can sometimes rhyme. Sometimes when they're doing some of these, alternate speech patterns, it can be, we have to really watch ourselves, because sometimes it can be kind of funny. So we have to be very careful not to laugh when people are having their alternate speech patterns. So I remember this one patient who was manic, and she was in a seclusion room. So she had to put the call light on to call us because she needed to go to the bathroom. But what she said was, through the intercom, she said, what does Batman say when he has to go to the bathroom? So we were like, okay, what does Batman? I don't know. Tell us what you want. And so she said, do, 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 do. So that was her way of, that was funny, but we can't laugh. Right, we really can. So, but it was kind of cute. So, but that's her way of telling us in her manic state that she needed to go to the bathroom. So, yeah, and she actually is the one in her very severe manic state. She was in a locked room, in a seclusion room, and she actually strangled or tried to strangle me at one point, because I was her nurse. And we all went into the room. I had a bunch of staff with me, and we were going to go in and give her medication. So I was handing her medication, and you'd have to do it in a very calm, quiet way. We don't want to overstimulate somebody with mania. So I was handing her medication, and she just lunged at me and put her hands around my neck. And, of course, other staff were with me, so they had to peel her off of me. And then they took another nurse took the med cup away from me, and just kind of got me out of the room, and then somebody else was able to give her meds. But for some reason, she kind of was targeting me and tried to choke me. And so then we had to lock the door back up and all that. And we actually were overstaffed that night, so I got sent home. So they were like, oh, Mary, just go home, And then I had the next couple days off. So she didn't see me for a few days. So in my absence for the next few days, as she was starting to get better, she was very worried about me, and she kept saying, I killed her. Where's Mary? I haven't seen her. I killed her. And then finally, they're like, no, she has a few days off. And so finally then she actually felt very bad. She was starting to get remorse about her actions after a few days, and she apologized because she was just manic, and she just saw the meds and didn't want them and just lunged at whoever was, holding on to the meds. So sometimes people who are in that full-blown mania can actually have some very violent content. So the grandiose delusions, I think, Andrea, you gave a really good example of that, causing or predicting 9/11 or causing things to happen. We've had patients say that they're a doctor and a lawyer and all these other things, and they haven't actually been educated that way. they may have persecutory delusions and feel like people are after them, out to get them. Those types of issues too. Okay, it's almost 10 o'clock, so I think we're going to end for today, and we'll start up again next week.